In my last video, a guy sent me a DM asking what type of screenings that I advised that he should do since he turned 40. Once a man enters into his 40s, screening becomes essentially important because early detection helps to prevent most major health issues. Some of the essential screenings I recommend for someone 40 and above are like blood pressure screening, which is done once in a year. This helps to identify the risks of heart attack, stroke, and kidney disease. Another screening is the cholesterol and lipid profile, which helps to identify risks for heart disease, arterial blockage, and stroke. Another screening is the diabetes screening, which is done checking your hemoglobin A1C and fasting glucose. And people who are high risk are people with family history of diabetes, people who do not exercise at all, and people with belly fat. Another screening is the prostate health screening, which is done for men 45 and above. But it can also be done earlier if someone has a high risk of prostate cancer. This screening is done through digital rectal exam, where your doctor is going to examine your rectum to check if your prostate is enlarged, and also done through a blood test called PSA, where your doctor is going to check the level of your prostate specific antigen to see if it is high and may be pointing towards prostate cancer. Another screening is mental health screening, which a lot of people pay no attention to. In midlife, most people have depression, stress, and anxiety. So it is important to screen for mood changes, sleep disturbances, loss of interest, and irritability. It is good to pay attention to your mental health as much as you pay to your physical health. Another screening is the colon cancer screening. Routine colon cancer screening begins at 45, but men 40 to 44 with GI symptoms, family history, and genetic risk should start early. The next screening is your eye exam. Without your eyes, you cannot see anything. So at 40 and above, people have a high risk for developing glaucoma, cataracts, and visual loss. Another screening is the dental exam, which most people do not pay attention to. And one thing they do not know is that dental diseases increases the risk for heart disease. The next screening is the testosterone level, and that could only be done if you have symptoms. Then for STI screenings, you can watch my previous videos where I have elaborated more on STIs. For more tips on your health, send in your questions in the comment section and I will unlock the answers.